Tetralogy of Fallot. Tetralogy of Fallot is a congenital heart defect. Though rare, it is the most common congenital heart defect and occurs in about 5 out of every 10,000 babies. Tetralogy of Fallot occurs in utero, but heart function can worsen after birth. The condition requires surgery and lifetime monitoring. Congenital heart defects are classified as either cyanotic or acyanotic. Tetralogy of Fallot is considered to be cyanotic because the defect obstructs pulmonary blood flow, as well as allowing oxygenated and deoxygenated blood to mix. This can lead to a characteristic cyanosis of the skin, caused by the low oxygen content of the blood that is flowing to the rest of the body. Tetralogy of Fallot is a collection of 4 separate heart defects that occur simultaneously. One of these defects is pulmonary stenosis, or a narrowing of the pulmonary valve that separates the right ventricle from the pulmonary artery. This reduces the blood flow to the lungs. Since the heart is forced to work harder to pump blood out of the right ventricle, the muscular wall begins to thicken, which can eventually weaken the heart. Also present is a ventricular septal defect, or a hole or septum between the right and left ventricles. This is problematic because it allows the deoxygenated blood from the right ventricle to flow into the left ventricle, where it is then circulated to the body. It also allows for flow of the oxygenated blood in the left ventricle to pass into the right ventricle, further decreasing the flow of oxygenated blood circulating to the body. This problem is heightened by the overriding aorta. In a normal heart, the aorta branches off the left ventricle and pumps oxygenated blood to the whole body. In the instance of Tetralogy of Fallot, the aorta lies just above the septal defect, allowing further mixing of the oxygenated and deoxygenated blood before it is circulated to the body. Again, the 4 abnormalities that occur with Tetralogy of Fallot are 1. Narrowing of the pulmonary valve, 2. A thickening of the wall of the right ventricle, 3. Displacement of the aorta over the ventricular septal defect, and 4. The ventricular septal defect itself, which is an opening between the left and right ventricles. The defects that characterize Tetralogy of Fallot occur during the first trimester of fetal growth. The cause of the defect is usually unknown, though it can be genetic. Additionally, there are factors that increase a baby's risk of being born with the condition. These include poor maternal health or nutrition, contracting a viral illness during pregnancy, a mother with diabetes, or having a parent with the condition. Additionally, Tetralogy of Fallot is often comorbid with other genetic disorders, such as Down syndrome or DiGeorge syndrome, and babies with Tetralogy of Fallot can often have other heart defects in addition to the tetralogy.
Symptoms are characteristics of an illness that are observable by the patient. In the case of Tetralogy of Fallot, cyanosis, irritability, and shortness of breath are the primary symptoms. Cyanosis is a bluish tinge to the skin, nails, and lips, especially in the extremities. Cyanosis, shortness of breath, fainting, and fussiness are all results of low oxygen saturation in the blood. A heart murmur can occur due to abnormal blood flow inside the heart. Additional possible symptoms are finger clubbing and slow growth. TET spells are one more severe manifestation of cyanosis. These are most common when breathing has been limited, like after crying or feeding. Young infants have TET spells more frequently because they've not yet learned how to manage them. What parents and babies learn is that pulling the knees to the chest helps to reduce blood flow in and out of the legs. This helps in 2 ways. It reduces venous return of deoxygenated blood and funnels more blood to the lungs to receive oxygen. As babies get older, they will often pull their knees to their chest to prevent a full-blown TET spell or squat for similar effect. There are a few signs for Tetralogy of Fallot. Signs are testable measures that indicate an illness. Low oxygen saturation is due to the mixing of oxygenated and deoxygenated blood in the ventricles before it's pumped out to the rest of the body. Since oxygen saturation is low, the body compensates by increasing hemoglobin in the blood. With or without surgical correction, which we'll hear about more in a moment, adults can have difficulty breathing and relatedly can struggle with physical activity, especially high levels of it.
There are several tests that physicians use to diagnose a patient with Tetralogy of Fallot. The most definitive test is an echocardiogram, which uses sound waves to produce moving images of the heart, allowing the physician to determine if there is a ventricular septal defect and where it is. They also use the echo to look at the pulmonary valve and the artery, right ventricular hypertrophy, and positioning of the aorta. Doctors will also use ECGs to check for arrhythmias and chest x-rays to see if there is any hypertrophy of the right ventricle. Cardiac surgeons also rely on cardiac catheterization to evaluate the structure of the heart in order to make a surgical plan, as well as check on pressure and oxygen levels within the chambers of the heart. If a patient is not treated for Tetralogy of Fallot, they will live a life of disability and reach fatality by age 20. Tetralogy of Fallot requires open heart surgery to repair the hole in the interventricular septum. Leading up to the surgery, a patient might have several hypoxic crises. These can be temporarily alleviated through medication, such as beta blockers. This is not a permanent solution, and the babies will require surgery. The intracardiac repair is open heart surgery that typically takes place within the first year. The cardiac surgeon places a patch over the ventricular septal defect. They also repair the pulmonary stenosis by widening the path from the right ventricle to the pulmonary artery and replacing the pulmonary valve if needed. Sometimes doctors opt for a temporary shunt surgery if a patient is born premature and or they have hypoplastic pulmonary arteries that cannot withstand the stress of open heart surgery. A shunt is placed from the aorta to the pulmonary artery to increase the pulmonary circulation so that the oxygen level of the blood is higher. This decreases the cyanotic symptoms until the heart is developed enough for the full intracardiac repair. There are several risks associated with the surgery required to correct the heart defect. Patients are at a higher risk for endocarditis, coronary heart disease, right ventricular aneurysms, and arrhythmias. However, the prognosis is rather good with a survival rate of over 95%. Arrhythmias lead to sudden cardiac death for 1 to 3% of this population. Over 80% of people living with a surgically corrected Tetralogy of Fallot are asymptomatic and can live a relatively normal life. Greater physical limitations are placed on patients that have a leaky pulmonary valve or dysrhythmias, such as restrictions from competitive sports or physical labor. All patients will have to get regular checkups with a cardiologist, which include ECGs, echoes, MRIs, exercise stress tests, and Holter monitors, which Holter monitors record heart activity for a continuous period of time, typically 24 to 48 hours. There are several implications for a PT when working with this population. Patients who are headed into surgery, patients who are just out of open heart surgery, and patients who had the surgical correction early in life but are coming to see you for a different diagnosis and treatment. Education is the primary purpose for PT for patients headed into surgery. It is important to educate the parents and caregivers, as most patients at this point are infants. It's important to educate them on how to care for the patient after surgery, such as what the different lines mean, how to care for them, and especially what the rehabilitation process will look like on a day-to-day basis. Additionally, it is critical to emphasize the importance of maintaining an active lifestyle. Because patients are already at a slightly greater risk for coronary heart disease, you don't want them headed down a path of unhealthy diet habits or sedentary lifestyle, as this will greatly increase their risk. Some possible complications from open heart surgery include arrhythmias, infection, and pulmonary issues such as chronic pulmonary regurgitation and atelectasis.
Physical therapy is used to prevent such pulmonary complications from arising or treating the complications when they do arise. Physical therapists should work on increasing general mobility, such as range of motion or ambulation, if applicable after surgery. Positioning of the patient should be changed on a regular basis to prevent secretions from pooling in the lungs. This is one of the leading causes of pulmonary issues in post-op cardiac patients. Segmental expansion is a technique used to activate the stretch reflex at regions of the lungs which are not expanding very well. This technique can be used to increase airflow to these regions. Postural drainage is an intervention that is used to loosen mucus and move it to larger airways so that it may be coughed out. Percussion is rhythmic clapping with cupped hands over the chest, and vibration involves moving hands in a fine oscillating motion just before and after expiration. It's important to note that certain positions are contraindicated post-thoracic surgery. It's important to note if a current patient, older child, an adolescent, or even an adult has had this diagnosis along with the corrective surgery early in life, as it could affect your plan of care for treatment. Be sure to look for any soft tissue restrictions at the site of the scar. Pay extra attention to their physiological response during therapeutic exercise. Of particular note, pay attention to their respiratory rate, behavioral response, and skin color. If you are going to check vitals, be aware that they might have an abnormally low baseline rate for oxygen saturation. If children are getting fatigued, they might instinctively retreat into a flat-footed squat, such as a baseball catcher. This stance increases their peripheral vascular resistance and raises their blood pressure.
In summary, Tetralogy of Fallot is a serious congenital heart defect consisting of 4 main abnormalities. These are a narrowing of the pulmonary valve, a thickening of the wall of the right ventricle, the displacement of the aorta over the ventricular septal defect, and the ventricular septal defect itself, which is an opening between the left and right ventricles. Though serious, the outcomes of surgery are typically excellent, and most people with the condition go on to live relatively normal lives. As surgery outcomes continue to improve, physical therapists need to be aware of pre- and post-operative treatment techniques, as well as being able to screen for adults with the condition in order to provide adequate care.